Nasopharyngeal airways. So these are all nasopharyngeal airways. Okay? Sometimes they'll call them nasal trumpets. So they're nasopharyngeal airways. When are they indicated? They are indicated either in an unconscious or semi-conscious patient. So you could use this on a semi-conscious patient. So unconscious or semi-conscious patient. Now, how am I going to know what size to use? You're going to measure from the tip of the nose to the earlobe. So the tip of the nose to the earlobe. Now, if it's too small, like this one, like on this one, it's too small. You see how it doesn't reach the earlobe? Mm-hmm. If it's not, because it needs to sit behind the tongue. So it has to be long enough. So in order to go into the patient, so you're going to first pick the size. And also these all come in French sizes as well. They're like 28, 30, 32, as well as having a millimeter size. So you'll usually grab a couple sizes if you're going to put it in a patient, because you're not going to be able to just look at them and go, oh, that looks like, you know, a 30. You're going to take a couple of them and you're going to see which size would be best. Okay? Then once you've determined which one you're going to use, these come in a package. Now, it's a clean procedure, but it is not a sterile procedure because the nose is not sterile. Does that mean you're going to wear gloves? You're still going to have gloves on. You're not going to, you know, lay it on the table. You're going to try to keep it as clean as possible. You're not going to drop it on the floor. Then you're going to lubricate the nasal trumpet so it'll go in. Okay? Now, when you're putting it in to the patient, you're going to go towards the center of the head. So you're going to be going like towards the center of the head. And again, it can only go one way. So I'm pushing it in. Not really. And you're going to, it goes towards the center of the head and a little bit down. And then you're going to push it all the way in. So it goes in just like that. And you're going to do it in one kind of smooth move. So again, towards the center of the head and a little bit down. If you're feeling resistance, you may move it a little bit. You're not going to try to, you know, push it in. And these are actually fairly soft, so it's hard to do too much damage. Now, once it's in, the patient can breathe through the nasal trumpet. So this is a way of maintaining an airway. So let's say my tongue is obstructing my airway. I put this nasal trumpet in. It's sitting behind the tongue. So the patient, the airway, the tongue is no longer blocking the airway. So now the nasal trumpet is in. How often must it be changed? Usually every 24 hours it's moved to the other side. And does it need to be taped in place? No, it stays in place. Now, even though you may think that looks uncomfortable, once you put it in, they no longer become aware that it's there. It's just like wearing glasses. When you first put them on, you feel them, but once you've worn them a little bit, you don't feel your glasses on anymore. And it's the same thing with this.
Who wants to volunteer?
No volunteers.
Yeah.
It happens every year. Nobody wants to volunteer. Okay, now, so that's the nasal trumpet. So you're going to insert one of those. So you're going to pick one out, you're going to lubricate it, and you're going to insert it to your patient. Now we're going to talk about oral airways. These are all oral airways, different types of oral airways. So when is an oral airway used? To open the airway when the larynx is being obstructed by the tongue. Usually that's the most common reason they're obstructing. Now, these ones can only be used in unconscious patients. The reason is because it is on the tongue. And if you were conscious, it could cause the patient to gag or vomit. So that's why it's only in unconscious or sedated patients. We wouldn't use it in a semi-conscious or conscious patient. Because usually if a patient's conscious, their tongue's not obstructing their airway. Also sometimes we'll put it in, if they have an endotracheal tube that they're biting on the tube, we'll put it in with the endotracheal tube, because this will prevent you from biting on the tube. Because what would be the problem if they bite on the tube, the endotracheal tube?
Air wouldn't get through.
Exactly, air wouldn't get through, so they wouldn't be able to breathe. So if they're biting on their airway, they're not able to get air. So that would be a big problem. Okay, how is it inserted? First, we're going to go from the corner of the mouth past the jawline. So that's how we're going to pick what size to use. So the corner of the mouth past the jawline. How about this one? You think that one's good? You want it past the jawline. How about this one? Yeah. Does that look? That one looks a little big. See how far it's going past the jawline? That's a little too much. So probably for this patient, this one would be the best one to use. So when you're putting it in, you can put it in two ways. You can put it in sideways and then rotate it into position, or you could put it in upside down and rotate it into position. I usually like to do sideways. So you're going to have to open his mouth. You're going to put it in sideways, and you're going to rotate it into position. And it should sit like that. If it pops out, you're probably not on the back of the tongue, or it's too big for the patient. So it should sit like that. Just a little bit of it should stick out of the mouth. So again, and it's an unconscious patient only. Sometimes, like I said, if you have to put in oral airway, sometimes they're clenching their teeth. I've had times where you may have to push their jaw open or use a tongue depressor to open their mouth. But never stick your fingers in their mouth. Why would you not want to do that? Right. You'd be like, oh, I knew I shouldn't. Now what am I going to do? So, yeah.
Squeeze.
You could squeeze, yeah. Squeeze and push down towards the back of the jaw, and you'll force it open. So again, sideways. Now normally they'll never have two airways, so they would never use an oral airway and a nasopharyngeal airway together. You'd use one or the other. I'm just demonstrating. So again, I'm going to push the jaw open, insert it sideways, and again, we're going to try to preserve their teeth, so you're going to try not to break any teeth when you do it. Sideways, rotate it into position. Okay, so when you come to this station, you're going to put both of these in. Practice putting